All right, Nico, can you say, welcome to another episode of Healthy Births, Happy Babies?
It's a happy episode. Happy babies.
Hello and welcome back to another episode of Healthy Births, Happy Babies. I'm Dr. Jay Warren, your host. I'm also a prenatal and pediatric chiropractor here in San Diego. I practice at the Cap Wellness Center in Encinitas in North County. We have amazing practitioners offering all kinds of different services and classes for pregnant mamas, getting them healthy during pregnancy and getting them ready for birth. We do postpartum care. We're doing pediatric care for the babies that are coming through. And I'm here today not to talk with you about that, but I'm here to share my conversation with Dr. Pam Stone about the 3 causes of dystocia. Dystocia is the medical technical term for slow, difficult, abnormal labor and delivery. And there's a lot of different causes of slowed labor or painful labor or abnormal labor and delivery, but we're going to talk about the main 3 causes that encapsulates almost all of those. And not only are we going to talk about what they are, but most importantly, we're going to talk about how to prevent them, because that's what's important, what you're probably very interested in, I'm sure. Dr. Pam is quite the expert on this topic. She herself is a practicing chiropractor in Georgia, working with pregnant moms, but she's also the instructor for the ICPA that teaches all of us prenatally oriented chiropractors the Webster Technique. She's taking over the course load and the course work, the course teaching for Dr. Jeannie Ohm, who unfortunately recently passed. And in learning the Webster Technique and how it works and how it can benefit pregnant moms for the pregnancy and in delivery, it's fundamental that we understand the causes of dystocia, and Dr. Pam is excellent at explaining it, not just to us doctors, but to you as an expectant mom, to understand how your body works, how it's supposed to function, what can get in the way of that, and what you can do about it. So after this brief message, I'll come back, I'll introduce her to you, and then I'll switch right over to our conversation so you can learn all about this. My online course, Connecting with Baby During Pregnancy, has been out for a while now, and I've been getting phenomenal feedback from you women who have been learning these prenatal bonding techniques, putting them to use, and having amazing results. The same kind of results that the women in the Rafi study were getting, where by doing these techniques throughout pregnancy, they were having less anxiety and pain during labor. They're needing less obstetrical interventions, including less C-sections. And then afterwards, the babies are sleeping better, which means you're sleeping better. And postpartum depression was less than 1% in the moms who did these techniques. So go over to my website at drjwarren.com/CWB and learn all about it. I think this course is amazing. I put a lot of effort into it, and I think it'll really help you have a healthier, happier, and more relaxed pregnancy and a gentler yet powerful birth. All right, my guest today is Dr. Pam Stone. She owns a family wellness salutogenic-based chiropractic practice in Kennesaw, Georgia. She's been certified in the Webster Technique since 1999. She's been an avid ICPA member since she was a student at Life University and has her diplomate in pediatric and prenatal care through the Academy Council of Chiropractic Pediatrics. Dr. Stone is part of the extension faculty of Life University now, hosting student interns regularly throughout the year. And she's also the past president of the Georgia Birth Network. She's a board member of the Academy of Chiropractic Family Practice. She's a member of the American Pregnancy Association, Holistic Pediatric Association, the Atlanta chapter of the International Cesarean Awareness Network, and is a peer reviewer for chiropractic research journals. She's been published numerous times in the Journal of Pediatric, Maternal, and Family Health, the Journal of Vertebral Subluxation Research, Pathways Magazine, Today's Chiropractic Magazine, as well as in Chicken Soup for the Chiropractic Soul. In her spare time, Dr. Stone is an avid runner and triathlete, and she credits regular chiropractic care for allowing her to be healthy and injury-free. So now let me turn over to my conversation with Dr. Pam. All right, Dr. Pam, welcome to the podcast. Thank you for joining me today.
Thanks, Dr. J. It's great to be here.
Yeah, well, I am very excited to have you because you are quite the expert in the topic we're going to be talking about. And it's something that a lot of our listeners is really, I don't want to say concerned about, but want to know more about and learn about so it can not be an issue for them in their birth. And then we're going to be talking about causes of dystocia, causes of difficult labor. But before we get into all of that, the listeners have listened to your bio and understand all of your amazing accomplishments. But if you wouldn't mind like telling us how you got to the point you're in now, where you're teaching about this, you're in practice, but how did you get started on that road to be where you are today?
I would say it started, 20 plus years ago when I was in the corporate world. I mean, I worked in corporate America. I used to do a lot of volunteer work with little pediatric organizations, YMCA and different stuff because I loved working with kids. I was getting really bad headaches. I was in, the 9 to 5 type of job. And I started going to a chiropractor because I was having headaches. And the stuff that this guy told me I was sort of blown away because I was like, oh, I'm just going to go for, my headaches, whatever. And within a few weeks, my headaches were gone. And he really talked to me about the power of chiropractic, about what chiropractic was, that it wasn't about back pain, that it was about nervous system function and better health. And I really just fell in love with everything he said. It just made total sense to me. And at the same time, I was training for a marathon because I'm a pretty big distance runner. And I had in the past had always been injured. I had been getting sick a lot. And so I started to see him and, 8 months later, my goal was to qualify for the Boston Marathon, which you have to run a certain time to do Boston. And so I was getting adjusted by him. The marathon came, I qualified. And it was a couple weeks later, I was looking at my race notes and stuff. And I realized the entire calendar year that I had been getting adjusted by him, which was about an 8-month period, I didn't get sick once. I didn't get injured once. And for me, that was like a huge wake up call to me of like, whoa, this is chiropractic, like I was able to train. Whereas in the prior years, I'd been getting injured and sick all the time. So I really that was like the kicker. And I literally just, changed my careers. I, quit my job more or less and moved to Atlanta and went to chiropractic school and really started all over again. And because I was a runner, I got out of school. I started working for a chiropractor who was a sports chiropractor because that's kind of thought I was where I was going to be going. I was involved in pediatrics at the school. I was the president of the pediatrics club. And I went to work for him and he's like, oh, you're taking care of all the pregnant women and kids. And I was like, okay, I loved it. Whatever. So I worked with him for about 2 years and that's really how it evolved. I mean, I just was like, I started working with them. When I opened up my own practice, I started networking really with just doulas and OBs. And I just dove into that world because I really loved it. And it's really just evolved. I mean, I think part of it is you meet the people who you can work with, you get good results doing what you're doing, and they keep referring people to you. And for me, it's just something that I've fallen in love with. I love being able to take care of these women, seeing them get good results, and then having it go from there. So that's really the story. It's not like, it's anything. It's just about health for me. It's helping these women. And so that was a really cool thing. I got involved with the ICPA many, many years ago, 20 years really, and been involved with them ever since, really since I was a student, being on different boards and stuff like that. So now that I'm going to be teaching it, it's just like a natural extension of everything I know and being able to help other chiropractors. So,
right. That's interesting. I didn't know that about your story. I have a very similar story in that it was sports that got me into chiropractic in the first place. Like as a kid, I'd hurt myself in volleyball, had some shoulder injuries, and I just really liked the vibe of being at a chiropractor and helping in natural healing. So I went to chiropractic school thinking I was going to be a natural sports doc. Right. And then in school, Jeannie Ohm from the ICPA was talking about pediatrics. And I had no idea that was even a thing that it could be, because another dream of mine had been to be a pediatrician. And so fast forward, it was kind of sports that brought me into chiropractic, found the ICPA and Jeannie Ohm's work, and then opening up to then, now being a part of like pregnancy and birth and pediatrics. It's just an amazing world.
It is. I think it happens the way it's supposed to happen. It just sort of evolves like that. But
right.
It's pretty
exactly.
Cool.
And now you're fast forwarding, like you're teaching for the ICPA, teaching Webster Technique, taking over for the late great Jeannie Ohm herself. And we're going to be talking about dystocia and difficulty in labor. So before we even start with that, can you explain to the listeners dystocia and how we're going to, work with it?
Yeah, I mean, dystocia is basically, it's like a difficult birth. It's abnormal labor. It's the women who have the failure to progress that end up with, whether it's a C-section or whatever, but it's not really a quote unquote defined subject, because it's all it is abnormal labor. And I always say, well, what's normal labor? And
Right.
to me, there's a very big difference between normal labor and common labor. And most of the women who come in, or most of the women out there, like, oh, a common, labor is, having contractions or having Pitocin and going to get an epidural and all these things. And that may be common, but that's not normal.
Right.
So that's like one of the differentiations I like to, talk to people about is the difference between common and normal, and then even what normal is and what abnormal is. So dystocia is really just that abnormal labor. It's failure to progress. It's anything that gets in the way of a woman, being able to give birth and causing that difficult birth. So there's a couple different things that involve in it, but that's basically the summary of it.
That's a really good point you made, because I think nowadays, like with so many difficulties being common, it's
Right.
kind of glossed into thinking like, oh yeah, I had a 24-hour labor also. That's kind of normal.
Right.
And again, the distinction of like, well, just because it happens a lot doesn't necessarily mean that's normal.
Exactly. Yeah, exactly. And people just think this is normal because I was in labor for days, or I went to the hospital, or whatever it is. And so that's one of the things that I like to talk to people about is just, just because it's normal doesn't mean or just because it's common doesn't mean it's normal.
Right.
That makes sense. So.
What would you say are the main causes of dystocia, of the abnormal flow to labor?
Right. I mean, I think in the in the OB world, in the midwife world, in the hospital world, there's really three typical causes that, a doctor will define. And one of them deals with just the nervous system and the body's ability the uterus to contract. Is basically deals with the body, the uterus is going to contract. It's going to have normal contractions or abnormal contractions. The cervix may or may not dilate. So women can go into labor and all of a sudden they get to, 1 centimeter or 2 centimeters and things stop happening. So that can be one of the causes of dystocia. That nervous system is not working. I mean, most people don't really think about what the nerves in our body do. Sometimes I talk to people and I'm like, if you make a fist, you make a bicep, the nerve is going to that muscle and causing that muscle to, be big and make a, contraction. And that same thing happens with your uterus. It just happens without people really thinking about it. And if there's any kind of problem with that, and it's not going to contract efficiently, and it's not going to contract the way it should, or it's not going to dilate, that can absolutely lead to the failure to progress, that longer type of labor. I would say the other big thing, especially when it comes into chiropractic world, is the balance in the woman's pelvis. Through a series of lifetime, people go through bumps and bruises and falls, and we have inability for our pelvis is supposed to, openly move left to right every time we walk, bend, twist. And if there's any kind of restriction in that pelvis, when the woman goes into labor, I always tell people, hey, it may open up, abnormally. It may not open efficiently. And so the baby's trying to come down a birth canal when there's abnormal movement in their pelvis and their sacrum. And that's where people will say, oh, the baby got stuck, or the baby was too big, or, you push for hours because that environment that the baby is in is not really conducive to birth. The other thing I'll talk to women about and just say the other really thing that can really contribute to it is the baby's position. Sometimes they're in their breech, they're in their transverse, they're in their, asynclitic with their head back or whatever it may be. And that's one of the things that, people say, oh, chiropractic, the Webster Technique is breech babies. Well, the Webster Technique is really all about the mom, not so much the baby. We're not doing anything to the baby, we're adjusting the mom. So if that baby's in a bad position because of abnormal pelvic movement, they're not going to come down the birth canal the correct way. They may be in the best position possible for them, which may be breech or maybe transverse, because that baby's pretty smart. Like the woman knows what they're supposed to do. The baby knows what it's supposed to do. But if the baby's in a bad position, it makes the whole labor a little bit more difficult. So those, in summary, are the three things that can cause dystocia. It's the nervous system not working as efficiently, the pelvis not moving the way it should be, and the baby being in a bad position. So.
Right. I think to talk about that first point, I get a lot of comments or even like raised eyebrows from women that I'm talking to with uterine contractions and talking about nerves firing. It's almost like they're thinking like, oh, the muscle's weak. and they'll ask like, how do I strengthen the uterine muscle? Almost like, how do I go to the gym to like get bigger biceps, right? Instead of understanding it's more about the firing of the nerve to the muscle. Like how do you explain that to parents about how the lumbar spine and the nerve functioning there affects things?
I mean, I literally like to just talk to them about the muscular contraction in the hands and the arms, even though that's a conscious contraction that we're physically doing it. Sometimes it just makes them realize that, oh, a nerve is going to that body part. But I'll say, hey, a nerve is also going to your stomach, and the nerves are also going to the, you know, every single part of your body, those nerves are going. And you don't think about these things happening, and you can't say, hey, I'm going to not have this contraction happen. I'm not, you know, I mean, it's not like a woman has any control about it. So we can get into talking about the autonomic nervous system to them and the function of how their body's supposed to work. But sometimes they just don't realize that how important the nervous system is in controlling everything. So if you can make that connection between the mind-body connection and the body's ability to heal, to me, if I can, sometimes I'm showing it to you, it's hard to do it on a you know, an audio podcast, but
right.
You can show them the movement and show them the nerves and show them what those nerves are doing. Then they start getting that little light bulb, like, oh, okay, that nerve is going to, you know, the uterus. So if that nerve is being misfired or not working well, then the body's not going to work as efficiently. So it's kind of explaining it to that way and talking about how, you know, there's so many causes that for that to happen. They just don't. Most people don't really think about how our bodies work. We don't think about that nerves are controlling our heart and our stomach and our lungs and our pancreas. You know, we just take it for granted. So if you can kind of break that connection and just say, hey, the body's doing what it's supposed to be doing as efficiently as possible. But if you can remove that nerve interference, the body's going to work that much better.
Right. And I think in pregnancy, at least in my experience, there's bridging that gap of like thinking about like, okay, your nerves are doing it. You don't have to think about it. That conversation goes easier in pregnancy because it's just thinking about like, you're not thinking about growing your baby right now. Like your baby is doing it on its own. Thank goodness I didn't have to remember where to put the elbows and the eyelashes on and everything right now. That's innate. But then also the birthing process, it's more of getting out of the way of the natural process happening rather than intervening and getting in the way of things. And that nerve function idea or a concept, I think is really, really important for a woman to really sink into and participate in a different way.
Right. Like I tend to even tell them that, like you had said, you know, they don't take a pill to form the baby's legs and to form the baby's arms. You know, it's like all of these things happen miraculously. And sometimes people just take that for granted. They don't realize that. They don't realize that how amazing their body is in creating this human being. And just the same ability that's creating this human being is the same physiology within them that should be able to birth that baby without interventions and getting away from that fear of, you know, a common birth, you know, where they're having all these outside interventions. So it's trying to teach them to trust their instinct and trust that their body knows what it needs to do. And if they can get rid of that fear, then they typically will have a little bit better of a birth experience. But so many women go into birth afraid or not knowing or trusting their doctors versus trusting themselves and trusting their body and doing their own research. And that can lead to a whole host of problems as well. I mean, that's part of the dystocia as well.
Right.
You know, if they're listening to everything other people are saying versus trusting what their own body is doing.
Right. Exactly.
It makes sense.
Yeah, no, perfect sense. The second main cause you were talking about with pelvic balance, I mean, obviously like with audio, you were saying like you can't really explain it. And as we were talking here, I seen our hands moving back and forth and the like, but in a kind of words description, like how can you paint that picture, that mental picture for a woman to understand the pelvic balance portion of what might get in the way of a natural labor?
You know, one of the things I will talk to the women about is, you know, if even just having them standing up and trying to bend their knee and bringing their knee up as high as they can and doing it with one leg and doing it with the other leg. And I would say most people have a difficult time doing one or the other. Like one leg may be easier to raise than the other. And it could be their balance. It could be just, they have pain in that area. And that right there is a sign that there's some kind of pelvic imbalance going on. There's that balance between the bones, the muscles, and ligaments. And I usually bring it back to when I say, if you have a daughter, if they have a child, or if they have a niece or nephew or something, and, that kid falls down 20 times a day, what happens if you fell down 20 times a day? And most people are like, oh, it's no big deal, they're little. I'm like, well, proportionately speaking, it's the same thing. A little child is falling when they're learning to walk. It's not much difference than an adult falling 20 times a day. And that little micro traumas from the childbirth and learning to walk process can lead to all these different problems that we have as adults. And so women, they just, a lot of people always have left-sided problems or right-sided problems, their knees or their ankles or their hips. So it's not always about pain, but it's about that movement. So if they have, pain on one side, or they're not able to bring that leg up as equal or something like that, that can be a sign, definitely a physical sign, a physical manifestation that there's abnormal movement or not efficient movement within their pelvis. And that can absolutely lead to more difficult labors.
Right.
So.
And the link of the movement of the hips going into labor has to do with like flexibility and opening of the pelvis, right?
It's opening of the pelvis. Like sometimes you could tell a person to, hey, put your hands on your hips, and you feel all the little bumps in the back. Well, that's part of their sacrum. That's part of their SI joint, and if you can talk to them about how that moves, and one side is supposed to open up and on the left and on the right when they're walking. Well, in the birth process, they both should open up equally for that baby to come out. And sometimes there's that one side that's restricted, so the right side may open better than the left. And when I say open, just that movement. But within birth, a few centimeters or a few millimeters can make a huge difference between whether that baby can come out the birth canal or not. And some people are like, oh, it's minor, but when you're in labor, if your pelvis is not opening up efficiently and it's a little bit less on one side than the other, even if it's by a half a centimeter, that could be a difference between an episiotomy and not, the birth baby coming out, or a C-section or whatever. So it's just little things like that can make a huge difference in that big baby syndrome, or the baby being stuck in a bad position. I mean, those are things right there that just tells me, oh, that environment that baby is in is not conducive right now because some kind of imbalance in the pelvis or the nervous system.
Right. Every pregnant woman I've talked to, whether they've birthed before or it's the first time, when we're talking about opening of the pelvis, like, I'll take any opening I can get as much as possible to open up that pelvis.
Right. Just a little bit more is going to make it that much better. I mean, that can make a huge difference. And sometimes that's just the woman learning how to move in labor. And, when they have that epidural and they're stuck on the bed, they're unable to really move their body. They're not able to listen to themselves and figure out, okay, what do they have to do to just shift maybe to let that baby come out a little bit better. And, the adjustments can make a huge difference with enabling that woman to have a better birth experience.
Right.
So.
And in functioning too, like if there's a ton of pain in labor, like say you were doing that test of lifting one leg and can't lift the other leg, then in labor, if there's pain, there's tools or positions taken away from you that you don't have access to. Your body might be calling you to move like this so baby can switch, but if you can't do it because you're in pain or just don't have the strength to do it, then you're more limited.
Right. Or they just don't know. They don't trust. They're not in tune with themselves. And because they have some kind of fear of the childbirth process, or, they don't really trust that their body is meant to birth. And sometimes they do, sometimes they don't. But, if they can trust that and realize, okay, no, I just got to shift this way, or I got to move this way, then it can be a better experience. But sometimes those common labors don't allow them to do that.
Right.
Unfortunately.
Yeah. And that's, with positioning and moving around during labor, sometimes it's moms feeling that instinct to move in a certain way that's going to open things up in a little bit, but it also is baby positioning of allowing baby to move maybe into a different position or open up. And that's that third one that you were talking about, as far as like baby positioning. Like, how does that relate? How do you explain how that relates to like pelvic positioning and the uterine tone?
Okay, well, so the baby's going to get in the best position possible for that baby, based on really the pelvic alignment and really the nervous system function and where that baby should be. And certainly some of it, yes, may depend on the muscles and the ligaments that are in that area. So the Webster Technique is really all about adjusting the woman and creating better balance with the bones, the muscles, and the ligaments. So if that baby may get in a bad position, they may not have that right, the abnormal presentation, whether it's the breech or the transverse or something like that. So that's what we're trying to avoid, is having them have that bad position and trying to get the baby in the best position possible only by adjusting the pelvis and adjusting the sacrum and doing the Webster technique. So the baby gets in that, funky position. And that's where a lot of women will go to a chiropractor. Hey, my baby's in a bad position. And we're not doing anything to the baby. It's all about the adjustments. It's all about adjusting the woman and creating that better balance.
Right. And I think that a lot of women coming in had heard of the Webster technique being the breech turning technique, which in years past, those terms were used, and we've gotten away from using that because it kind of implied you're going to a chiropractor to move the baby around, which one is beyond our scope and also not even what we're doing. And it's really that same thing of like giving the baby space to get into their best position, which typically allows for different positioning that's going to allow for a better birth.
Yeah, and it's unfortunate that it is referred that way, and there are some chiropractors who still say that, and I am like, kind of makes me crazy when they say that, because I'm like, okay, they're not really educated. They're not really knowing the appropriate thing with what Webster is, because Webster is not about that. It's really about if you can adjust the baby and get, adjust the pelvis and the woman and create that balance between the bones and muscles and ligaments, and the baby's going to do what the baby is supposed to do. That fetus is going to get in the better position. And if you're adjusting the person with real specificity and doing, in a sense, the right thing, most of the time it makes a huge difference for these women. And that's why there is such great results with Webster technique, because it's a very specific analysis and very specific steps that you're going to be taking to adjust this woman, analyze the person and adjust them to make it a good environment. And if that environment that the baby is in is not conducive to birth, then it won't work as efficiently. So it's, in a sense, it's kind of a hypothesis. You're saying, hey, if we do this, then the baby's going to be getting a good position. And yes, it is a hypothesis, but we really have seen, if you're doing it effectively, then it can be really beneficial for the mom and the baby, really, in the whole birth process. So.
Right. It's kind of one of the jokes I make with some of the pregnant moms is like, I'm doing all this work with your body and like, I absolutely care about you, but really I'm doing it so your body's optimized so baby can come through this birth that much easier, which obviously is going to help mom, and mom wants a good birth too. But I kind of jokingly say that to tie in like babies in this process as well.
Yeah. Right, it is. And I always say, hey, one of the side effects of this is that, you're probably going to have less pain too, because even though, meaning not so much less pain in labor, or you can have that, but, a lot of women have low back pain during pregnancy. But if you're adjusting the Webster technique and you're adjusting their spine and their pelvis and you're removing that nerve interference, then the side effect is that their body's going to work better and they're going to have less discomfort typically during the pregnancy. And that's what's always so cool, is women are like, oh, I had no problems during this pregnancy, they didn't have any pain and stuff. So I joke that it's a side effect because a lot of people go to chiropractors because of pain, and we're like, no, that's not our purpose. Our purpose is to adjust the spine and the nervous system and get the body working efficiently so everything works better. And then the woman generally will have a much better birth experience. So. Right.
Well, so in our closing moments now, we've talked a lot about Webster technique and a lot of people know about it, but like, how would you explain like what a Webster trained chiropractor is doing for a mom and with a mom, and maybe even like what they're not doing with the mom?
I would say what they're should be doing is the Webster technique and analysis, which in the past was really just like a 2-step process. Now it's a little bit more in terms of working with ligaments and bones and muscles, and really, like I always say, you're creating a good environment for the baby and for the mother. You're creating as best an experience as possible. So if a woman, I think first of all, they should get adjusted, but B, find somebody who is certified in the Webster technique, because it's so much more than just an adjustment and just an analysis. Somebody who's been doing it for a long time, has those connections to doulas or childbirth educators or midwives, or will just know so much more about the entire birth experience. And to me, that can help the woman tremendously. They're not going in afraid and just trusting other people. They're learning the connections and learning other things that they can do. So I think going to a chiropractor, first of all, is huge. Second of all, getting to someone who's Webster certified, and ideally somebody who has even advanced training through the ICPA, because that person's going to have a lot more experience and a lot more knowledge. One thing, we get a lot of referrals from other chiropractors, which I think is really cool, is when other chiropractors send their patients to me, we start adjusting them during pregnancy, and then they go back to their chiropractor after they give birth. And sometimes they don't, and sometimes they keep their babies with us and they get adjusted back at their other chiropractor, and their babies still get adjusted by me, which is really kind of cool. But that's what I think chiropractic really should do around the world. If everybody could just work together and refer other people, so if someone's seeing a chiropractor now and they love that person, but they don't really know Webster, then go to someone who is Webster certified for the pregnancy, and then, go back to that other chiropractor later if that's what they want. But,
Yeah.
I think it's kind of like people graduate from medical school as a medical doctor, and then they have their different specialties, and you would never go to a podiatrist if you were pregnant, for your prenatal care. You would go to an OB or a midwife. And the same thing is with, chiropractic. We all graduate as chiropractors, but people really should find someone who's really specialized and specific in what they do within their own, profession and within their field to help that woman as best as possible. So
right. I've had that same experience of getting a lot of referrals from other chiropractors for during the pregnancy, because this is not what I specialize in, and or moms just kind of innately looking around their office and saying, I haven't seen a pregnant woman here before, or maybe that style of adjustment doesn't feel right for them during their pregnancy, and then being able to have them go back to their regular doc to that's taking great care of them afterwards. But because it's a specialty, you want to make sure you're taking really good care of them.
Yeah. And I was one thing you would ask, and I would say is people come and they say, oh, my chiropractor used to always lay me on my side and, quote unquote, crack my back and adjust my back. And I'm like, that's one thing you really don't want to be doing with the Webster technique. So to me, that can be a red flag, maybe not a red flag, but a flag that chiropractor may not be efficiently doing Webster. I mean, there are ways to do it effectively, but that's something to look for, that if your chiropractor is doing different things, and they are pregnant women in the office and there's no pregnant, signs or posters or things like that, then that can be a clue that, hey, maybe you need to see somebody else during your pregnancy, just like you would go to an OB or midwife while you're pregnant as well. So,
or if their chiropractor is saying well, now that you're pregnant, I'm not going to adjust the pelvis out of safety, because they're not doing that, which is better than doing adjustments that'll be contraindicated. Right. But at the same time, what we've talked about is the pelvic positioning and movement is so key for the birth, that you want to make sure you're having somebody well-trained doing that work.
Right. And I've heard that before, is that the chiropractor doesn't want to adjust them, and hopefully most of the time they'll refer them out to somebody who does like to adjust them and knows what they're doing, so.
Good. Well, I'll make sure in the show notes that I include a link to the website on the ICPA site that shows where the Webster certified doctors are. So if you as a listener are in a part of the world, part of the country, you want to find one, you can find it there. But Dr. Pam, how can people get in touch with you? Where can they learn more about the work that you're doing?
I would say probably through our website itself, which is activelifechiropractor.com. We're outside of Atlanta. There's a lot of Active Life Chiropractic offices around. So our website ends with chiropractor.
Okay.
But that's probably the one place. We also have a Facebook page, Active Life Chiropractic. But again, there's also a lot of other Facebook Active Life Chiropractic pages. So I think it's Active Life Chiro is our Facebook page. So people can find us there, or find me there, or through the website.
Okay, well, both of those links, specific links, I'll put in the show notes as well, so they don't have to search and fish around for it. They can just go straight to it, so that they can get right to you. And in our last minutes now, what would you say is the major take-home message you'd like the listener to get from what we talked about today?
I'd love the woman to know that they were meant to give birth. A female is meant to give birth, that they have an amazing ability and physiology within them. So if they don't get afraid, if they get rid of that fear and try to have a quote unquote normal birth, then they can have an amazing experience. I mean, so many women get afraid of birth and they watch other movies, and it's like saying, hey, tune into the people who are going to support you in having a normal birth, and try not to be afraid, because if you're not afraid, you're going to have a much better experience. And if you do all these things naturally to take care of you, know that there is such thing as a normal birth, which is, going to be a much better experience for the woman, and trust their instinct, and trust that their body has the ability to do this, and to listen to their gut instinct and listen to themselves, and obviously get adjusted, because that can make a huge difference.
Huge difference.
So that's probably the thing, is trust in themselves, and find a chiropractor who knows what Webster Technique.
Beautiful. Well, Dr. Pam, thank you so much for being here today. I know you're super, super busy with everything that you're doing. One, in your practice, two, with the ICPA and your own family life. So thank you for taking the time to connect today. I appreciate it.
You're welcome. Thank you.
Hi, it's Dr. J again, and I want to thank you so much for listening to the podcast. It's something I really enjoy doing, and I, as a parent, learn a ton from these experts coming on and sharing their wisdom, so I hope you're getting a lot out of it too. And I want to share something else with you. I've created a guide called the 40 Ways to Connect with Your Baby During Pregnancy. It's full of simple things you can do on a day-to-day basis that will help strengthen that bond that you have with your baby. It's a free download. You can go to my website at drjwarren.com/40ways and just enter your email. I'll send it right to you. You can download it and start working on it right away. All of the research that I'm learning in the fields of epigenetics and attachment parenting is showing that the more bonded you are during your pregnancy with your baby, the better the birth is going to go and the better parenting is going to go, because you have that strong foundation, a strong connection to build upon. So go again to my website. It's drjwarren.com/40ways and get that free guide. And again, thanks for listening.